My name is Linda Avery-Patz, and we're here to discuss the pros and cons of using patient simulators in paramedic lab training. First, you may ask, what is a patient simulator? Well, they are medical patient simulators that are life-size. They have a heartbeat, they have a pulse, they can breathe, they can talk, you see their chest move, they can cry. All sorts of different things. This virtual patient can be programmed to display a variety of different medical emergencies, everything from cardiac arrest, trauma, IED explosives, all of those different things that we may see out there in the real world. They can produce a heartbeat, a blood pressure, or a lack of blood pressure. Sometimes that's more important than having a blood pressure. These computer-based patients can also respond to medications. I can give a medication such as epinephrine, and I would expect, based on my paramedic training and my knowledge that I've learned in the classroom, that his heartbeat is going to increase. His heart is going to race. His skin may get sweaty and diaphoretic. That's what I'm going to see on this computer-based program. I've delivered the medication, it will read it as delivered, and now my patient is having these responses. Very important. You may ask, why do we use them? Why is that important? Why are those things that I just said so important in our paramedic level training? Well, because we're going to be doing these on real-life patients. Here it gives us the opportunity to sharpen those skills, gain confidence, see what type of reactions this patient is going to have, as well as what reaction I'm going to have, and do that all without any danger to a real-life patient. Certainly decreases the liability not only on us as a student or as a healthcare provider, but as the healthcare provider facility or service that we're working under or training under. The practice unites nurses, physicians, all allied health instructors of all sorts, and providers in a structured environment. It promotes communication, learning, collaboration, a feeling of teamwork. The benefit to the practitioners, and of course, it's also a benefit to ultimately the patients that we're going to be working on once our training is complete. In the addition of reducing medical-related accidents, medical simulators can store performance history, provide detailed reports, and then even suggest improvement strategies. It's difficult to get clinical times in those hospitals and emergency rooms and operating rooms in particular to practice those skills we so need to be effective care providers. The simulator can mimic those patients and their responses, and it has no liability to the facility or for this physician. Now, there are cons to medical simulation. It started in the military. A lot of the pre-canned scenarios are based on those military things, which is primarily trauma and emotional aspects. A clinical simulation today is a high-tech event. It can be expensive. The high-tech mannequins are controlled by educators to deliver these responses. They also need to be maintained. They're not fixed locally. They need to be sent out, so there'll be a period of downtime when you have no patient simulator in which to use. Most colleges are down to one because of the cost, so it's hard to get time scheduled for that patient simulator. So to get a certain number of minimum hours you need, you may be doing it at all sorts of different odd hours, which again, now the facility needs to be open and have a tech available for those hours as well. One of the biggest disadvantages to simulation is no matter how realistic they are, they always fall short. They are just not real. Sometimes the environment isn't as stress-charged as a real-life emergency would be, and that definitely affects our performance. In the back of our mind, we're thinking, I'm really not going to kill them, so I can kind of do whatever I want. I don't have the accountability as much because I don't believe that it's real. The cost of the equipment, lack of training for educators, and the lack of access truly does limit our availability to truly make it all it can be. there are drawbacks, and unfortunately it has so much potential and it's very much underutilized. However, research indicates that simulation does improve learning. Okay? Simulation is especially effective in developing skills and the procedures that require hand-eye coordination. Simulation training helps learners to prepare for the unanticipated medical events, develops teamwork, develops communication skills and critical thinking skills. It increases our confidence, it improves our performance. In my classroom, the pros outweigh the cons, and we will adapt to whatever we need to make it the best it can be for our students and ultimately our patients. Thank you.